we're very fortunate to have Spencer, Gina, and Erin work together instead of being on the ground to implement the vision, on a day-to-day basis as they interact with the patients. So thank you for joining and speaking.
Very good. Good afternoon, everyone. Thank you for allowing us the opportunity to share about our journey. So last summer, Spencer, Erin, and I started working together under the Sheikh Khalifa Stroke Institute. The groundwork was already laid down thanks to the hard work of our colleagues. So over the last year, we continued to work diligently to further shape the program into an even more collaborative and robust program, bridging evidence-based practice into clinical treatment and patient care. We now like to share about the interdisciplinary focus of our program with a macroscopic viewpoint of promoting recovery across the continuum of care. So some of the objectives we like to cover include the development of the interdisciplinary team model, use of high-tech and low-tech treatment approaches to promote acquisition of skills, benefits of patient and family engagement to promote recovery, and to emphasize the importance of community reintegration. And as a disclaimer, therapists would have to use their best judgment in assessing therapy prognosis, barriers to discharge, and insurance authorization to consider the best plan of care. Therapy goals would be focused on remediation, adaptation, or compensation to promote safety and functional independence. In this presentation, we will focus on treatment approaches to target remediation of skills. The development of a unified, cohesive, interdisciplinary treatment model will allow therapists to better mold and temper individualized treatment programs to optimize clinical outcomes. The need for consistency and functional skill training across all disciplines is critical in supporting the patient's learning potential and the ability to generalize skills within the home and community. We'd like to review how we further develop structured and unstructured interdisciplinary communication. Our intent is to advocate for the patient's recovery journey by identifying potential barriers early on and highlighting tools that will promote successful outcomes. I believe Erin might be having technical difficulty, so I'll go ahead and continue on here. But basically, structured meetings are scheduled, routine, and organized. So the Neuro Round meetings occur during the lunch hour on the second and fourth Monday of every month. We noticed great potential to go beyond reporting the status of the patient's functional abilities by creating space to allow for creative problem solving and idea sharing. To maximize on our time spent on solution-driven discussions, two things occurred. First, the therapists are encouraged to add information about their patients on a secure information sharing platform. Details would include functional mobility status, level of support to complete transfers, upper extremity function, visual skills, dysphagia diets, communication skills, cognitive skills, safety awareness, and barriers to discharge. Second, the clinical specialists meet to review the updates the Friday before. New patients and those with special needs and concerns are prioritized.